Cancer can affect anyone. In 2007, nearly 20,000 new cases of cancer were registered in New Zealand. That's about 1 in 200 people. Cancer affects a person's health and can also affect their feelings, their appearance, their level of energy, and their relationship with others. Cancer doesn't only affect the person with cancer themselves. It also affects their family, friends, workmates, and other people that they have contact with. My name is Rachel Coppage. This DVD includes information for the deaf community about cancer. It talks about what can happen from when someone is diagnosed with cancer onward. Cancer affects everyone differently, so everyone will have a different cancer story. But the important thing to remember is that you don't have to go through this experience alone. Having cancer is like a journey, and there is lots of support available, so no one has to travel on this journey alone. Later on in this DVD, we will meet two remarkable women, Angela Suhoi and Elizabeth Hines, both talking about their personal experiences about going through this particular journey. So what is cancer? Our bodies consist of cells. All our organs, bones, muscles, skin, blood, and other fluids are all made up of cells. Sometimes a cell starts dividing uncontrollably, forming a group of abnormal cells. As these multiply, they form a mass called a tumour. Not all tumours are cancer. There are two kinds of tumours. Benign tumours, which are usually not life-threatening, and malignant tumours or cancers that can invade and destroy normal tissue and form secondary growths. Dr. Richard Sullivan, Director of Cancer and Blood from Auckland Hospital, we'll talk more about what is cancer later on in this DVD. From the time that you hear you have cancer, there will be many adjustments to be made. You will meet a bewildering number of health professionals who are all involved in your care. The doctors who specialise in the study of and treatment of cancers are known as oncologists. As part of treatment, you may require surgery. Sometimes you will see another specialist in combination with your oncologist. The specialist and your oncologist will then talk about your treatment. Nurses are trained to assess, monitor, and report the symptoms and side effects of cancer and cancer treatments. Providing information and education on all aspects of cancer care is a key nursing role. Nurses are skilled listeners and provide practical and emotional care for people with cancer and their families. Oncology social workers are trained in support and counselling in a number of areas, such as adjusting to the illness and the resulting changes in lifestyle, managing feelings of anxiety, depression, loneliness, stress and grief. And assisting with relationships between family and friends. Information and advice about community resources that may assist with accommodation, family care arrangements, managing at home and finances, New Zealand's Health and Disability Code, number 5, states that everyone has the right to have an interpreter to talk with members of their cancer team. Now, let's go and meet Dr. Sullivan to talk about general cancer and various treatments. What is cancer?
Rachel, it's a really good question, and it's not as easy as it might seem to answer that question. Cancer really is a group of abnormal cells that have gone wrong. So when we're growing and developing from childhood through to adulthood, our cells are always replacing themselves, multiplying, changing, and our cells are always repairing each other and changing themselves. Now, normally we evolve into who we are. The way I try and describe cancer to people, it's when that process is interrupted, and instead of the cell dying and being replaced by a new cell, it turns into an abnormal cell which over time becomes cancerous. And the way we try and put cancer together is that cancer is when the cell can then live and survive on its own. It doesn't require the body's control systems to stop it from behaving, and that's why it then spreads through the body and causes the harm it causes. So in many ways, this might sound an unusual way to put it, but as we grow up, as we're born, as a baby, we're very dependent on the environment we live in, and we're supported by our parents in our environment that we live in. As we get through teenage years, different tensions and pressures of society, our hormonal changes occur, and then we grow into adults, and at that time we're in a slightly, normally more stable environment. And sometimes it can be a simple thing as a change in a gene or an exposure to a compound such as asbestos for a tumour of the lining of the lung. That means that cell starts to build its own environment, and when it builds its own environment, initially it just starts to duplicate. It still represents the cell it started from, but as it gets more in control of itself, it builds its own bloodstream system. It then enters into the human body's bloodstream system to use that to move around. And I guess that's when we define what we call a malignant cancer, as a growth that has been able to set itself up in its own way to then use the body like, in a way, a railway system, whereby it leaves the train station, it might leave a carriage at another place, that grows in another place, and that cancer represents the same place from where it started from. And that's why, in a way, which is an area which confuses quite a lot of people who go through the journey of cancer,
So could you please explain what is chemotherapy and radiation treatment? And also, what are the major differences between these two treatments?
Again, a good question, and I'd probably separate out into maybe 3 different treatments. So actually, one should never forget surgery. Surgery is actually a critical component of managing anybody with cancer. More people, in fact, are cured from their cancers from surgery than any other treatment we use. And that is a challenge for many people, because surgery can be deforming, it can change the way we are. So it is important to remember that's a critical part in the journey of trying to treat and eradicate cancer. From the point of view of where does chemotherapy and radiotherapy sit in, radiotherapy it's like targeting treatment. It's a bit like spot welding, really. It might sound a bit depersonalised, but that when you've got an area where you know the cancer is, then you can target rays, in a sense X-rays, that you can't see, but they are high dose radio waves which focus on the tumour and change the DNA of the tumour so the tumour dies. And so for many people, they will have surgery, radiotherapy and chemotherapy, because they all have a different role to play. So the chemotherapy is about all the cells, wherever they may be. And so again, if I look at the example I've talked about when you had a lung cancer, a tumour in the lung, that cancer may well get into the bloodstream or the lymph stream, like, as I said, use the example of a railway track, and travel to different parts of the body. So you might radiate the primary tumour, or you might radiate a secondary tumour that's causing pain, but we know there will be cells elsewhere. And so the concept of chemotherapy is that's given normally through a drip, a bag of fluid, a chemical in that fluid, and that runs through the fluid into the veins, and it searches out, in a way, rapidly dividing cells. But again, with chemotherapy, that's why people get side effects, because normal cells are dividing as well as the abnormal cells. Now, what differentiates cancer in many ways is it's often a very rapidly dividing tumours, and that's what chemotherapy attacks. That's why you'll see cancer cells shrink and sometimes disappear on chemotherapy.
In terms of making decisions about what method should a patient consider, could you explain what does conventional treatment mean? And also the difference between complementary and alternative therapy.
Again, a very good question, and I guess I term complementary and alternative as the same. I think that these are therapies which are given either in place of or alongside what would maybe be termed Western medicine therapies. So the word alternative, literally means an alternative. So someone might do that instead of that. But someone could also do the same thing complementary to that therapy. So, for instance, people might take selenium, which is an iron that this country is low in, and they might take that instead of Western medicine, or they might take it with Western medicine. So, look, my personal view is that these should all be complementary. They shouldn't be alternative. I guess we're trying to learn and understand where different therapies fit. The way I describe it to people, I bike to work most days, and I describe it to them like the wheel of a bike. That, in a sense, the person living cancer is like the hub of the wheel. And what you're doing is you're collecting spokes. And you're collecting spokes to build yourself a strong wheel to take you on a journey that's going to take you where you want to go to. And look, I would like to believe, and as I say, I appreciate I'm biased, I'd like to believe that what we have to offer as oncologists, surgeons, radiation oncologists, is good care to improve the outcome. But we should be able to give you the choice. So we should be able to explain to you what it's about, the pros and cons of that treatment, and then the individual is able to make that decision. So that's a few spokes. The family, the other therapies out there, whatever they may be, whatever that person's exposed to, their personal beliefs, cultural and religious beliefs, are part of building that whole wheel to make sure it's strong enough to deliver the outcome that's right for that person.
We are here at the Cancer Society to meet a woman named Faye. and to ask her some questions about the delivery of services. How does the Cancer Society help people understand about cancer?
Cancer can be difficult to understand and raise a lot of questions and concerns, and it helps to talk to someone who you can trust for up-to-date and well-researched information, as well as for understanding and support. The Cancer Society has for many years provided its own well-researched information, and we have staff who can help talk to you about that information and help you understand it. The information is for anyone who's got a concern about cancer, who's been diagnosed with cancer, or who cares about someone with cancer. Family and friends, workmates can all be helped by the information that we provide. We provide information about all types of cancer, diagnostic tests, treatments, side effects, how to get support, especially in the community, research, clinical trials, reducing your cancer risk, and how to live with cancer and cope with cancer.
How does the Cancer Society help people get through their treatment?
We have a lot of services all across the country from our 6 divisions who can provide transport to treatment or let people know how to get access to treatment if they have to travel. We have some financial assistance is available. You'd need to go to your local branch and ask about that. It's fairly limited, but the staff would be happy to talk to you about it. We have accommodation facilities in each region for people who have to travel a long distance for transport, where they can stay mostly free of charge while they have their treatment at their local cancer treatment centre.
How does the Cancer Society help with emotions?
All of our staff understand that emotional effect of cancer and can offer support and understanding, but we also have staff who can visit in the community workers or liaison nurses who can come and help with that and listen and help you understand. We also have a counselling service that's available in most parts of the country, support groups where you can meet people who are in a similar situation to you. We have a Cancer Connect service, which is a web-based service where you can talk online to people in a similar situation, and that's moderated by our Cancer Information Service nurses. There is the Cancer Connect service, which is a telephone-based service, but it's provided by our trained volunteers and we match people with a similar cancer diagnosis so that they can talk to each other about what they might be facing and how they got through it. We also have a program called Living Well, which is an education and support program that helps people meet and get together, and it's facilitated and takes people through all the stages of cancer and what they might be expecting, and especially the emotional effects of cancer.
For women having treatment for cancer, there's a program called Look Good, Feel Better. And this program teaches makeup and skincare techniques to help restore appearances. Now let's go and see what Angela Suhoy is up to at Look Good, Feel Better. please tell us about Look Good, Feel Better and its background?
Certainly we can. Look Good, Feel Better was actually originated in the United States some 20 years ago and now represented in 23 countries around the world. And New Zealand is the 20th year of operation for Look Good, Feel Better.
What can a person expect when attending a workshop?
Well, actually what the person can expect is that they come along and basically we like to call it a little bit of a pampering session. They learn about how to deal with the side effects of their treatment. And of course the program is open to anyone who's undergoing treatment for cancer. So they might lose their hair, their eyebrows or their eyelashes, and obviously skin tone can change, might have some quite high colour, and this can all be looked after and coped with within the workshop. All the tutors are well trained in knowing how to absolutely relax everyone at a workshop and ensure that they walk out of there looking as normal as possible. There are several ways that a person can register for the workshop. We do have registration forms on our website, so they can actually be filled out online basically and sent back through to Auckland head office. And then obviously they're sent around the country. Patients get an orientation pack when they're diagnosed with cancer, and all our brochures and registration forms are in there. There is an 0800 number that they can actually call, and all things are collated through the Auckland office.
In terms of your personal journey, from the time you were diagnosed with cancer and up until today, could you tell us your personal experiences while going through this journey?
I wanted to see a doctor to check a lump I found on my breast. I arranged a day when I was available and made an appointment to see my doctor. However, after checking the lump, the doctor thought it best to organise an appointment at the breast clinic. I had a series of tests including a mammogram, a scan similar to what they do to check pregnancy, as well as a biopsy. It was sent away to confirm whether the lump was a tumour. I recall that week very clearly, as it just seemed to go so fast. I really didn't have time to actually stop and think about what was happening. I remember Tuesday was the doctor's appointment, Wednesday the mammogram, as well as the biopsy and scan, and the results were ready on Thursday. The doctor wanted me to go over and see him on Thursday. I was feeling a little uneasy about it, so I asked my sister to come with me as it was short notice to organise an interpreter, but I just had to go and see the doctor. When I arrived, I said hello, but I could tell from his facial expressions that it was not good without anything being said. My sister burst into tears. We sat down and I asked the doctor what exactly was going on, but to clarify and make sure I fully understood, I asked the doctor to write it all down to ensure that I understood everything that was being said. Effectively, he told me I had breast cancer. My GP said that I had already referred to a specialist doctor. The appointment had already been made. The appointment was the next day, which was a Friday. Obviously, my family and Alan were all very upset on hearing this news. However, for me, because it happened so fast, I don't think it really sunk in, and I knew I just had to get on with it. My initial concern was for the immediate family and my children, but then I thought it was just as important to find out exactly what the specialist doctors had to say. I went through a barrage of tests, consultations and more tests, and after a few weeks the decision was made to have surgery to remove the breast. They had initially thought that they had caught the cancer early, but unfortunately during the operation it was discovered that the cancer had already spread. It was quite hard news to take in, so again there was more discussions with the specialists to find out what my options were. I was sent home to rest after the surgery and was told I would need 6 weeks to recover from the operation. After 5 weeks of not doing anything at home and being bored, I was determined to go back to work, so I decided I just had to go back early after 5 weeks.
What was the important factor while going through this journey? And how did you manage to keep such a positive frame of mind?
I think my family, Ellen, and my children is something that has kept me determined to make sure that I'm around to watch my family grow. I was also aware that in this day and age, medical advances have improved. Unlike 15 to 30 years ago, where it was common for people to die of breast cancer, the likelihood of surviving breast cancer has vastly improved. So I knew I could live with cancer and to enjoy my life now and make the most of what I have. I didn't have a care in the world. I wanted to enjoy my life, my work and my family.
Well, I have met others who have family members who have had breast cancer, and they say they often feel depressed. Angela was not like this, as she was able to maintain a positive attitude. I know all women would handle it differently, and it would be difficult for some women to stay positive.
Yes, that's true. I've also heard of women, when finding out they have breast cancer, they get depressed, and they can get into a cycle of depression. But for me, I was determined to make sure that I didn't focus my energy on worrying about cancer all the time, and to ensure I enjoy life and make the most of it and move forward with a positive attitude. I knew I had to lead a normal, balanced life with my family and carry on as usual. By doing that, it allowed me to cope with cancer. I also had a lot of support from my family, my children and my husband's family. It was really great.
Could you tell us why it's so important not to go through this journey alone?
At the start, it's important to set up your support network as soon as possible after being diagnosed. I had set up 2 groups. One was for my family and my parents and sister. The other support group were 9 close deaf friends who I wanted to support me through my journey with cancer. They were a tremendous support for me. We told stories, we had laughs and talked about anything to take my mind off cancer. Laughter was one of the best ways of getting through cancer, as we shared stories and experiences of our lives growing up together. I also found talking to and getting tips from others that had been through cancer very helpful.
Based on your personal experiences, could you tell us what was the most important role that you had to undertake at the time of your wife's diagnosis with cancer and up until today?
From start to finish, I was conscious not to pamper her or fuss over her, as it was important that she maintains her own independence and made decisions about what she wanted to do and what she thought was best. We equally shared our roles. Our first priority was to maintain a positive attitude for her and our family.
In the past, many people really didn't know much about it, or they had fears about cancer, either from hearing stories or information on the internet, which may have been incorrect. It is important that people find out the true facts about cancer from their doctor and then do their own research so they fully understand. By doing research and understanding more about cancer, we will make the process of dealing with it a lot clearer. The public's attitude is a lot better now due to public fundraising, as well as the different awareness programs out there now, such as breast cancer, bowel cancer, ovarian cancer and prostate cancer. As a result of these different campaigns, people are more aware now about the different types of cancers.
Some of my deaf friends have family members that also have cancer. So talking to them and sharing our experiences has been great and positive for me as well as them. I would come home and share this with Angela.
The deaf community has very little access to information, but I suppose with your family and friends you could do a lot of sharing and talking that helps with the support.
I had no idea about cancer when Angela was first diagnosed, but gradually I was able to learn more and more. Some of the information I found was mind-boggling. For example, different stages of cancer and then what each stage meant. It was very complicated.
At the time, many of the general public had an understanding of what cancer is about. However, many of the deaf community are still unaware. For me, finding information about cancer within the deaf community was difficult, as there was very little to be found. So going through this journey and realising that there is very little information out there for the deaf community made me start to realise, with the help of others, that it is important to create resources for anyone in the deaf community for the future. By having access to this sort of information, we'll take away any fears that there may have and realise that there is nothing to be ashamed about. For me, I think having the support of my friends, my husband, my family and children has been wonderful.
What is your advice for those who are recently diagnosed with cancer? And from your perspective, what is the most important thing for these people to be aware of?
I recommend making sure that an interpreter is with you for your appointments. Take family and friends for support, as they can take notes, so later you can go back through all the information provided by the doctor to help you better understand. Make sure you go through all the documents given to you. And also arrange friends to help you through the chemotherapy so you have someone to talk to, as this will help you take your mind off the treatment for the hours that you are there. I had friends with me so we could chat and have some laughs during the treatment. Anyone that has been diagnosed with cancer, I would recommend to set up a support group, whether it be family or friends. And also make sure that you get just the facts. Ignore other stories or myths that might be out there. Just get the facts from your doctor and in a way that you will understand. You can also visit the Cancer Society, who have information you can read, as well as they offer one-to-one counselling if needed. Get lots of rest and don't worry about the future. Make sure you talk openly to family and friends, as they will help you. They will definitely help you.
In terms of your personal journey from the time you were diagnosed with cancer up until today, could you tell us your personal experiences while going through this journey?
My personal journey with cancer started 19 years ago. It first started with a tumour on my forehead, just above my right eye. The second time I had a tumour just here, under my right eye. The third time was another tumour just here, on the side of my nose, and then they found that I had breast cancer. Now, how many is that? 1, 2, 3, 4. Yes, 4. Fourth time was when I had a tumour here on front of my nose. And the fifth time and last time was 2 years ago, but I had 2 tumours, one on the front and one on the side of my nose. So my journey with cancer has taken a long time. In total, 17 years.
When I listen to you, I can see that you're really amazing. You've kept very, very positive throughout the whole procedure. How did you manage to keep that positive sense?
It's about not being ashamed of having cancer. I have always been open with anyone about the fact that I had cancer. I wanted to be out and show everyone that despite suffering with cancer, that this is who I am. I would explain to anyone about the steps I had to go through when dealing with cancer, so they were aware if anything happened to them or others in the future. I want to urge all women to do regular checks for breast cancer by self-examining for any lumps as soon as possible. Don't put it off.
Michael, your wife was diagnosed with cancer 17 years ago. So 17 years is a very long time. It's been a very long journey. Your role, your responsibilities, what did you find important about supporting your wife?
I had to make sure that she had as much free time as she needed at home, and I know she worked hard at her job at the school. I made sure I helped with the housework at home. I also took more responsibility for the finances as well to make things easier at home for her, as it has been a long 19 years. We are lucky that we own our own home and have a flat next door that has provided us with some rent money, which has kept us afloat. That has been a big help. It was also important, I think, for everyone to have medical insurance to cover some of the expenses, which relieved us of some of the financial pressures. And there are lots of other things. We made the best of our time by regular outings like going out for coffees. We wanted to focus on the time we had together now, rather than worry about savings and retirement. So we would go away on lots of holidays. We have been to England twice, we have been to Holland, and I think Australia once, which has helped Elizabeth feel really relaxed.
So that is really important advice. But have you got any more advice for people out there that you would like to tell? Or something that they need to be aware of?
I would recommend that you tell your family as soon as possible. Don't hide it from them. Let them know straight away.
Tell everybody.
Then later on, tell everyone that you know in the deaf community so that they are all aware of what you're going through. If you let your family and friends know what is going on, then they will help you. If you keep quiet about it, then they won't know that you need help. Keeping it to yourself will only make it worse.
That's right.
And you will deteriorate really quickly.
Another bit of advice is to consistently use the same interpreter. Using different interpreters can get confusing. Using the same interpreter will make it easier, as they would have an understanding of the background and be familiar with all the steps you've been through on what can be a very long journey.
I would like to pose a difficult question. Who should tell the children that you have cancer? Ideally, it should be the parent who has cancer that should tell them, providing you have good control of your emotions. It is okay to cry, and it's actually good if this happens, because then your child will see you crying and therefore realise that it's okay for them to cry as well. If while you are telling them that you have cancer you become extremely emotional and lose control, then your child will react the same way and make the situation worse for both of you. So it can be hard to get that balance right. It won't be easy. In your heart you will know whether you're the right person to tell your child that you have cancer. However, if you think and feel that you don't have it in you, then maybe you can ask a family member or a close friend, or even a professional, like a doctor or a nurse, whoever you would feel would be the most appropriate to explain this to your child. Another question is, When do you tell your child that you have cancer? Ideally, the best time to tell your child is after you've been diagnosed. And also as you go through the various treatments. Make sure you explain what the treatments are and what the side effects may be. As a result of this, there will be some changes within the home, so make sure you let them know. And also tell them how you're feeling as well. After all the treatments are finished, then you should explain to your child whether the treatments have made a difference or made any changes to your health. If you have more than one child, then this poses another question as to whether you tell them individually or as a group. Initially, in the early stages of your cancer, it would be ideal to explain it to them individually, as their ages will differ and it will be easier for you to match their individual understanding. After that, you'll be able to explain your progress to them all together. Another question is, how much do you actually tell your child? Do you tell them everything, or do you just give... The best way would be to follow the lead of your child, and depending on their age and level of understanding, that may determine how much information you give to your child. The right amount of information will be the pace to make sure that the child is able to understand everything that you've told them. Be sure to explain the different stages you are going through so they keep up to date with what is happening. From the time you are first diagnosed and through all the different stages of cancer, you will also go through stages of shock, disbelief, anger and self-pity. And as you cope with this, you will change and you'll go through a reorganisation, then hope and acceptance. Your children will be going through these same stages as well, and you will find that their experiences will be very similar to yours. Your children will ask lots and lots of questions, and the best way to respond is by just breaking it down to level they will understand and avoid going into too much detail. There will be lots of medical terms that can be quite daunting and frightening for them, so keep it simple. Your child may ask you a question that you don't know the answer. Don't try to make up an answer. It would be better just to be honest and tell them that you don't know. It is okay to say you don't know. If you make up an answer, then they will not have accurate information and will have a distorted picture of what is happening. If you listen carefully to them, you will get a sense of their understanding and whether they are coping. You may have to repeat yourself several times to make sure they understand. You need to listen to them and gauge what it is they are saying and clarify their understanding, and if need be, you may have to explain it to them again and again. Your child may not want to talk to you about the cancer, so don't put any pressure on them to do so. You may want to ask a family member or close friend if they are willing to help and support your child. And if your child agrees, they may feel more comfortable talking to them. Being diagnosed with cancer often means that you'll become very ill. This may mean that your children will have a little bit more responsibility to help around the home. You may find that you're not able to do the same things as before because of your illness. The routine and rules that you have at home should stay the same even after being diagnosed with cancer. Don't make allowances because of the cancer. A child needs stability, so the best way to do that is to maintain the same household routines you had before you were diagnosed. Cancer can affect everyone within your household. They may not show it and may not want to express how they are really feeling. It may appear to you that they are coping well, but they are still internalising it, and they will be affected in some way. It is important to make sure that you maintain a normal household routine, and if at all possible, make sure that you'll be there to support and help your family when needed. If you want to be a good listener for your friend with cancer, try to suppress your own concerns and feelings. Listen carefully to your friend and try and get an understanding of how they are feeling. When you visit their home, try not to look uncomfortable or scared, but just do exactly what you would have done before they had cancer. Say hello, give them a hug, hang up your coat and pull up a chair. Respect your friend's privacy and also the privacy of the others in the home. Listen and be patient and respond appropriately without overdoing it. If your friend is talking and wanting to get something off their chest, just wait until they have done so without interrupting. And make sure you wait until they are completely finished. If they pause when talking, don't use that time to interrupt and ask them questions about what they've just said. Just wait until they've completely finished and said everything they wanted to say. You just need to be very patient with them. Quite possibly, your friend may just want to talk quietly to you. They may stop for a while to gather their thoughts, or maybe they just want some quiet time. Just a time to sit and reflect. On the other hand, they might want to just get everything out, and they could be expressing feelings of anger and frustration. Remember not to offer them advice, as this could frustrate them even more, as they really just want to vent and offload. They're not asking for advice. Just use the time together to build up your relationship, and just have a good laugh and have a good time together. Some people are fortunate and have family close by who are their support. However, others may be alone, or family that might live further away, so they may be feeling quite lonely. As a friend, you could take on that role and be their family support. You could ask your friend whether there's anything you can get for them. They may want you to bring them a book to read, or bring them a crossword puzzle, DVDs or music. Or maybe they just want to go for a drive somewhere. Also check if their family members, partner or children may need anything else you can help them with. Don't ask them over and over again about their cancer or the medical treatments that they are going through. Just let them be. Also, if you know of other people that have had cancer, then it's not a good idea to talk to your friend about their history or the things they might have done in the past. The most important thing you can do for your friend is to give them your time. Listen carefully to them and perhaps talk. Cancer can affect anyone. In 2007, nearly 20,000 new cases of cancer were registered in New Zealand. That's about 1 in 200 people. Cancer affects a person's health and can also affect their feelings, their appearance, their level of energy, and their relationship with others. Cancer doesn't only affect the person with cancer themselves. It also affects their family, friends, workmates, and other people that they have contact with. My name is Rachel Coppage. This DVD includes information for the deaf community about cancer. It talks about what can happen from when someone is diagnosed with cancer onward. Cancer affects everyone differently, so everyone will have a different cancer story. But the important thing to remember is that you don't have to go through this experience alone. Having cancer is like a journey, and there is lots of support available, so no one has to travel on this journey alone. Later on in this DVD, we will meet two remarkable women, Angela Suhoi and Elizabeth Hines, both talking about their personal experiences about going through this particular journey. So what is cancer? Our bodies consist of cells.